Welcome to Senior Moments, the show where we talk about all things senior, the good, the bad, and the utterly ridiculous. Today I have with me Cindy Poot. She is from Access Home Care. Welcome, Cindy.
Thanks for having me.
Oh, you're welcome. So tell us a little bit about Access and what you do.
So Access Senior Home Care is similar to home health, but a little bit different. So we are private duty or private pay care at home.
Okay.
So we have CNAs, MAs, caregivers that don't have a licensure, but they provide in-home care, dressing, bathing, transportation, meal prep, laundry, pretty much anything that you might need when you're at home other than administering medications.
Okay.
Wound treatments, we don't do that. And we don't have licensed therapy staff. So that's what kind of differentiates us from home health.
Okay.
And then we don't bill private health insurance. We are either private pay, long-term care insurance, or sometimes we're able to assist with VA benefits.
Okay.
Mm-hmm.
Now, with the, you said you also have nurses? Did you
Yes.
say that? So what's their function, since you're not giving medical care, correct? You're not giving medical care?
Well, our owner,
Okay.
He's a licensed RN.
Okay.
So anytime that we get a start of care, is what we call it for a new client, he'll go out, do any assessments that the patients or clients might need. If there's a question or a concern that a caregiver or a family member or the client themselves has with the medication, whether they should follow up with their primary care doctor, something like that, he can step in and kind of answer some questions. So it would be essentially the same thing as if you were to call like an 800 number for the nurse
Okay.
line on your insurance card. That's what he steps in to provide reassurance for the clients, for our caregiving staff.
That's really a nice benefit.
Yeah,
Yeah.
he's really good and really accessible when people need him.
And it's really nice to have that coordination so that you're not trying to find out from a different agency
Yeah.
the answers to the questions. It's a lot more streamlined just to be able to have him right there and
Yeah.
be able to give good advice.
Yeah, either in person or over the phone. He's always readily available, which is great.
Okay.
Yeah.
So what kind of shifts do your people have? Do you have 4-hour shifts, 8-hour shifts? How does that work?
They vary, honestly. They're
Okay.
they're kind of dependent on what the client needs. So we can do some long shifts. Like we have a lot right now that have been established clients for a while that are 24-hour shifts.
Oh my goodness.
Yeah, so we'll have one caregiver come in for 12 and then they'll rotate off for another 12.
Okay.
Some are 10 to 12-hour shifts, some are 6 to 8-hour shifts, and some are short, like
Okay.
4-hour shifts. And then we have some that are just, picking them up at home, taking them to the doctor, accompanying them while they're out, and then bringing them back home. So it's literally just a medical appointment transfer or
Sure.
transport.
What's the minimum amount of time then that I could contract to have somebody come?
We try not to do a minimum time lot, but for the more like remote areas like Groveland, Ione, Pioneer,
Okay.
where it takes the caregiver a substantial amount of time to get there,
Sure.
we try to stay at least 4 hours minimum,
That makes sense.
to make it worth the time to get up there.
Absolutely.
Yeah, so it's not too bad.
No, that's not bad at all. So what areas do you cover?
Me personally,
Or the company?
the
both?
company. Access covers all the way from like the high Sacramento area, all the way down the 99 corridor to Turlock, up to Groveland, Sonora, San Andreas, Jackson, all the way up to Pioneer, Ione,
Okay.
and down. So it's kind of like a big,
Big circle, right?
yeah.
So the Tri-County area, do you guys go up to Alpine County?
I don't know if we currently have anyone up there, but if there was a need, we could try to see what caregivers we have in that area.
Sure.
To
I mean,
pull.
because if you're already in Pioneer, you're
It's
not
like
that,
right there.
Right.
Yeah.
Right. Poor Alpine, they're so small and they
I know they're so little and they're just.
they get the short end of the stick sometimes, I think.
Yeah, but there is a need over there.
Yes,
For sure.
absolutely.
Yeah.
Now we've got a pretty big veteran population in this
Yes.
county. Are you able to serve them?
Yeah, we have some that are currently on service right now. So we can't help them get established with their VA benefits for that. But if they're already established with their aid and attendance, we're able to help them, or our business office manager is able to help them see how they're able to apply some of those benefits to cover the cost.
Okay.
Sometimes it might not cover the entire cost, but at least, you know, offset it a little bit for them.
Right. And that's good for the spouse too, isn't it?
Oh, yeah.
Yeah, so that's
Yeah.
really good to know. And
Yeah.
so in-home care services, and then so you are non-medical, just to be completely clear.
Non-medical.
Okay.
We can help them put their pills in their boxes, you know, give them reminders, but we're not able to actually give it to them.
Right. They've got to be able to get it out of the box, get it into their mouth, and
Yeah. Or, you know, if they have family that's in the house,
well, yeah,
they can do it too.
sure.
Yeah.
Family special.
Oh, yeah.
Yeah.
And we have quite a few that have husband and wife in the same home on service together. You know,
Oh, that's great.
different degrees of assistance needed, but yeah, so we do that also.
Yeah. How do people pay for your services?
A majority right now are private pay.
Okay.
And we've been in business or the company's been in business for over 14 years.
Oh, nice.
So they have quite a few established clients that they've had on service for a while. And one thing that kind of sets them apart is they're a small, tight-knit company, not a corporate company, you know.
That is the impression I've been getting, that it's
Yeah, they're very quality over quantity. So that's one thing that kind of drove me to them,
sure.
because I could see it. And their caregivers that they've had on staff have been there for a while, so they know them like family. They know their personalities, they know who they're going to mesh well with for clients. So we have a great success rate with keeping people in their homes.
That is wonderful.
Yeah, I love that.
Yeah. And I think it's really important. I think you made a really important point that you're able to match a caregiver with a client. You're not just going, okay, number one, you're going with number two, number three, you're going to number four. You're taking the time to see, because not everybody has the same personality. Sometimes, you know, people can rub me wrong and they don't actually mean to, but it's just me. And then I might rub them wrong, and it's nothing really bad that I'm doing. It's just their perception. It's just, you know, we don't quite mesh, so that wouldn't be any fun.
No, and the way that they match them up, you know, the personalities, their things that they like to do around the house, because some people are like homebodies. They like to just sit and chat. Some people like to watch TV. Some people are really active and like to be outside. So finding the right person for them is super important.
Oh,
And
absolutely.
they really take the time to do that, so yeah,
Yeah,
I love it.
that's great. So what kind of training do your caregivers get?
They get really extensive training. So they get in-office training. So they go over, you know, all the medical what-ifs. They go over caregiver basics, the same thing that CNAs would get trained on.
Oh, great.
Even though they're non-clinical, they still get some of that same training. The in-home training, they have a quality manager go to the home, so they go over documentation with them, you know, what to do in case of an emergency. The ones that are bedridden, they go over safe transfers, toileting, and they're able to use Hoyer lifts in the home. So they're trained in the office, you know, book training, if you will.
Right.
And then the hands-on training is quite extensive for them.
Oh, that's wonderful.
Yeah.
Yeah. So how do you recruit your caregivers? Is it you have everybody from 16 well, it wouldn't be 16, but like younger people to my age, or?
Most of ours are probably early 20s, mid-20s, and up. They've been with us for a long time. So they sometimes will recruit amongst their friends because they have such a high expectation for what they do.
Right.
They don't want anyone coming in that they're referring that's not going to be up to the same standards. We have a lot of applicants and we turn a lot away because we're not just looking for bodies to fill a time slot. They have to meet the same expectations and high standards, that the caregivers that we currently have, because we're not just going to bring someone in to fill, 2 missing spots. We'd rather pay someone that we know is qualified and skilled to be able to do that,
Right.
as opposed to just bringing in someone that you're kind of,
Iffy about.
yeah.
Yeah. Well, you have to be really careful, I think, because you're dealing with a very vulnerable population, and you need to keep their
Yeah.
safety and
Yeah.
happiness in mind.
Yeah, and we're fully staffed right now. We actually have 6 new caregivers.
Oh, nice.
For the Sonora Groveland side, and then I think one for the Stockton area. But they had good referrals coming in, and I'm really excited to get them out in the field. But
Oh, good.
yeah.
So you're going out in the field and calling on people, or what's your job like?
Right now, I am just hitting the market, my territories for the foothills and Oakdale, Turlock, Modesto area. There are so many community events, meetings, assisted livings, and hospitals.
Right.
So that's been my main focus, is just rebuilding those connections.
Okay.
Yeah.
Speaking of assisted living, I believe in my past life there were some caregivers that would go into the assisted living communities that I was marketing.
Yeah.
And they were contracted by the families because they just wanted extra care for their family. In assisted
Yes.
living, you've got a group of people, of course, and you don't get the
congregate
one-on-one
living.
that you can provide.
Yeah.
So,
Yeah, and we work closely with home health and hospice.
okay.
That's why I've had a couple meetings at assisted livings in Modesto, actually, this last week. So if they are in the independent side, and then they have the assisted side.
Correct.
So if they're on the independent side and they may just have a change of condition, like maybe they had a fall, a planned surgery, or a urinary tract infection, so
Sure.
they don't need extensive help, just maybe for a week or so to kind of
Right.
keep them on the independent side, because you don't want to have to move them, uproot them, and we would come in, help them with their dressing, their bathing, help them get from their room to their meals,
Okay.
because when they're independent, they don't have that
I see.
service. So we could come in, help them for a week to 2 weeks. Doesn't even have to be 24 hours. It could just be 3 hours in the morning, 3 hours at night.
Sure.
And then hospice, whether they're in a assisted living, independent, a boarding care, or at home. Sometimes the families are just too overwhelmed,
Oh,
and
that's understandable.
they just want to be the family,
Exactly.
and process and grieve, and they don't want to be the caretaker.
I can understand that.
Yeah, so that's where we would come in and ask them what their needs are. What do you feel comfortable with? How can we help? Sometimes they just may need someone to help them change the bedding, because you have hospice workers coming
Right.
out. So we just kind of supplement what hospice is already doing
Right.
to take that burden off the family.
Well, and hospice can't be there 24/7.
No.
So, things could happen. A bed
Yeah.
could get soiled, or something
Yeah.
could happen in between hospice
Yeah.
visits, and then it'd be great to have that extra help on hand.
Yeah.
Do you guys do appointments where all you're doing is showering people? That seems
Yeah.
to be a big issue.
We have one caregiver that does that for, I believe, 3 different clients, and that's literally her day.
Okay.
She just goes between the 3 of them. So,
Yeah.
Yeah.
Oh, that's great.
Yeah. And sometimes that's all it takes to be able to keep them in their home,
Exactly.
Yeah.
Yeah. Well, I know as I've gotten older, I'm looking at my bathtub and it's been slippery a few times, and I've got, maybe it's time I go out and get those little
The little
flower
slippy things.
thingies, that you put on the bottom of your bathroom.
That, or like a little bench. You need to.
Yeah, there's that too. And then I've got a grab bar that actually will come out of the hole. So it's not really all that safe. I guess I should get in there and do a little home repair so I don't end up on my head one day.
Call me.
I'll do
come
that.
and help you.
Thank you.
Like no falls.
I'm really trying to avoid that, because it seems like that's a big #1 thing that happens to seniors. You're doing great until you have
just
that
takes
fall.
one-
It just
one
takes
thing.
one fall, and it can really change your whole life.
Yeah.
So we try to avoid that.
Yeah. That'll be me. I'm accident prone. Wrap me in bubble wrap.
There you go. What's your favorite part of working for Access?
My favorite thing? Being able to promote something that I 100% believe in. Knowing that the care that they provide is exceptional, and I can wholeheartedly 100% say that and believe it.
That's great.
So that, yeah, a smile that won't leave.
Yeah.
Yeah.
Well, I think that's important. I believe that people trust you like they tend to trust me, and I don't think that you want to abuse that trust. So
No.
it's really important, I think, on a personal level,
Yeah.
to believe in what you're doing,
Yeah.
especially in that arena.
Yeah, and you're not only caring for someone, but you're doing it in their home.
That's right.
Whether their home is their house, an assisted living facility, or somewhere else, because that's their home. You know, you have to treat it with that amount of respect.
Absolutely.
Yeah.
Now, do you have some clients that want you to do their hair or things like that?
Yep. We have some that just want us to come in and do their hair. We just had a client, she was in the hospital for 8 days, and when I saw her on her first day, that's the first thing she asked me to have the caregiver do was please wash and braid her hair for her.
Oh, nice.
And I said, we can absolutely do that for you. She wanted that done before she even wanted to eat.
Oh, my goodness.
Yeah.
Well, I don't blame her there.
Yeah.
Yeah.
But we have some clients that want us to do their shopping for them, their meal prep, even though the caregiver may not be there every day. They love the way that they cook. We have some that have really good culinary skills.
Oh, great.
So they will prepare, 4 days worth of meals for them.
Oh, that's wonderful.
Yeah, and it's one thing that stands out for our caregivers. And yeah.
Now, do you take them on, if people want to, are you taking them to an activity if that's what they want you to do?
Yeah.
Like,
There are some that like to go to church, some that like to go to bingo. I think there's one that goes to, what is it, the Moose Lodge meetings?
Sure.
Or Elks Lodge, I can't remember which one. But
Animal with horns on the head.
yeah. Yeah, but we do that.
Oh,
Yeah.
that's great.
Yeah, and then we have one client, she likes to go out and get her hair and her nails done, so the caregiver goes with her.
Oh, that's wonderful.
Yeah.
Now, does the caregiver drive them in the person's car or in their own personal car?
It could be either, whatever their preference is. Some clients we have, they prefer their car, and some, depending on the caregiver and if the height of the vehicle.
Sure.
So some vehicles are too low and it's too hard, it's easy for them to get in, it's harder for them to get out.
Right.
So depending on the ease of the actual vehicle.
Well, and of course, you might have a client that's got a standard transmission, which someone isn't able to drive.
Exactly.
So there's that issue as well.
Yeah.
Yeah. I've been driving my truck lately. It's standard transmission. And it's amazing how quickly that habit gets into you, because then I go to the car and I'm reaching for the, I'm reaching for the clutch and reaching for the stick shift, and it's not
And
there.
you can't do it.
No, so I can fully understand that some people might not be comfortable driving another car that they're just not used to. So.
Right. And then some, they have a preference because they're the heated and cooled seats.
Oh, yes.
Yeah, depending on, what area you're in and the time of year.
Sure.
They love that. So.
Heated seats up in Pioneer or Groveland is a beautiful thing.
Right.
Yeah.
Yep.
Well, that's great.
Yep.
All right. So what are we not touching on that we should be touching on?
The biggest question that I've had since, I've been out the last couple of weeks is people didn't know how to go about getting information, or if they wanted the service, how to go about referring their mom, or referring, sometimes doctors want to refer someone and they just didn't know how to do it. The biggest thing, or the most important thing, is just making a phone call, either to myself or to the office, and then we have a quick 24-hour turnaround, same day.
All right. What is your phone number?
I don't have
Good
it on
question.
me.
That's all right. I'll look it up and we'll put it on We'll do an overlay. So walk me through the process really quickly. I call you up, and then what happens?
We do a quick assessment, just ask some basic questions. Are you home? Are you at the hospital? Do they have any clinical needs? Did they just have a surgery? Did they just have a fall? We want to know if they want to stay in their home.
Sure.
Did you want help here, or did you want us to help you in an assisted living facility?
Okay.
So those are the biggest questions: is location, their clinical needs, and then we discuss the finances. We never start with the money because we want to know what their needs are. We want to know where they're going to need the help before we help them figure out the financial part.
And then, as far as I know, we've got long-term care insurance that some people can access. We have private
Yes.
pay, which hopefully people can access. And then
Yeah.
Veterans Services provides some
Yeah.
aid and assistance.
Yes.
That's the three that I'm aware of. Are there any others that you know about?
I'm working with, we actually had a call on Monday and we're going to follow up with her, but Blue Magnolia,
Oh, yeah.
Jeannie, we're working with her especially for the Sonora Groveland side or the foothills, to see about delving into the tribal benefits.
Oh,
that's something
that'd be
that
great.
Access hasn't done yet, or they're not quite familiar with. So
Sure.
that's one thing that we're going to.
That would really be good for the community if you could do that.
Yeah.
Yeah.
I'm hoping.
Yes, absolutely.
Because there's such a need.
Yes.
Yeah.
Yeah.
Yep.
All right.
Yeah. I'm just happy to be able to be in the area and getting information out to people, and seeing where I can help.
That's
Yeah.
amazing.
Yeah. Makes
So-
me feel good.
Yeah, it's, I think that's so important that you're doing something you love and you're passionate about, and I can see it in just talking to you how much you're, how much you love your job. So that's great.
Yeah.
That makes
love it.
everything a lot easier.
Oh, yeah.
Yeah.
Yep.
All right. Well, I am so glad you came today. It was really
Thank
nice
you.
talking to you. Thank you to our audience. I hope that you have enjoyed this show as much as I have. Please join us again next time.